All right, class, so we didn't really have enough time to go through this one, so let's take a second and see what we can do. All right, so we've got this kid that comes into the ED, and he's been vomiting for 6 hours. He's 10 years old. He's been really thirsty, and he's been peeing a lot for the last 3 weeks. Pulse is 120, respiration's 32, and he's got sunken eyes, diminished skin turgor. When you do the serum studies, hyperglycemia, so blood glucose quite high, you see ketones and you see metabolic acidosis. Urine is spilling out glucose and ketones. We've got a problem. So which of the following sets of hepatic findings are you most likely to see in this patient? So if you were to reread this again and take 2 seconds and pause this video, what would you say out aloud to yourself would be the suspected diagnosis in this kid? So if you hit pause, what would you say out aloud? And I would say you have an undiagnosed type 1 diabetic, right? You've got ketosis, you've got hyperglycemia in the 10-year-old, you've got the urine, you've got the thirst. There's probably been unexplained weight loss as well in this kid. Okay. So with that, you've got a diabetic state, you've got a metabolic crisis. Are you expecting to be synthesizing fatty acids? Are you expecting to be oxidizing fatty acids? Well, if you've got ketones, you're most likely going to be in oxidation. So let's remember back to this handy-dandy slide in a second. Let's remember we're going to be looking at pKa. We're going to be looking at the phosphatase, PP2A, that's going to regulate your acetyl-CoA carboxylase, and we're going to be looking at cyclic AMP levels. Okay, so this kid, undiagnosed diabetic, ketones, glucose spilling out into the urine, metabolic crisis. We're not going to be synthesizing fatty acids. If we're not synthesizing fatty acids, we do not have activated ACC. That means it's inactivated, and that means we have a phosphate group tacked on to ACC that is important for its inactivation, all right? If that phosphate group is hanging out here, that means that phosphatase is not doing its job, and it is likely inactivated. Its activity, therefore, you could say, is low in this one, all right? So if you were to go back to the question and look at your answer choices, you could include any choices that say low and immediately strike out any answer choices that say high, because that's wrong. High would be indicative of fatty acid synthesis, and you know that that's wrong. So already you've increased your chances of having a correct answer, even if you don't know the rest of the answers to the question. So that's cool. All right, let's keep chugging along. pKa. We know that pKa does a lot of things, right? Here's pKa, and it's talking to the phosphatase, right? pKa is negatively regulating the phosphatase. We know that we want this phosphatase to be turned off, to be negatively regulated. Therefore, pKa, we want it to be doing its job, negatively regulating this thing. So its activity in this case should be high, right? Let's look over here, pKa. pKa is a cyclic AMP-dependent kinase, and it's pointed towards lipolysis. Remember, this is the process where we have the triacylglycerol with 3 fatty acid chains that are sitting tacked on to that glycerol-3 backbone, phosphate backbone, right? And we rip them off 1, 2, 3 at a time by ATGL, hormone-sensitive lipase, and then that constitutive MAG lipase, right? Okay, so if we're going to do lipolysis to go and get fatty acid oxidation chugging along, and pKa is important to positively regulate that, this activity, we need that to be high. So this should be high. Woo! High. Okay. Cyclic AMP. If Protein kinase A is cyclic AMP dependent kinase, and its activity is high. Cyclic AMP is likely quite high to keep this kinase happy, right? And therefore, over here and over here, we should have high levels of cyclic AMP. And remember that glucagon, the activation of that 7-transmembrane protein, one of the downstream effectors is the activation of cyclic AMP, okay, if you remember from our lecture. So cyclic AMP in association, guilt by association with pKa and the firing of glucagon in this energy depleted state should be high, okay? So what you're looking for is high, low, high. Okay, and that should be your second choice in the Pull Everywhere slide. Make sense? And look at us. Look what we did. We picked choice number 2. And we are awesome. Cool. If you can pull this off, you are awesome. And you have a pretty firm handle on hormonal regulation of fatty acid oxidation and fatty acid synthesis. Have a great night, everyone.